The pod site has 5 activities: command, operations, planning and intel, logistics, and finance administrative supports. Each pod site will have a site manager responsible for overall pod operations. This person is the primary site decision maker. The site manager communicates directly with City Emergency Operations Center, or EOC, officials. The City EOC officials, in turn, will communicate with the Operation Area EOC officials. Since some of our cities will be operating multiple pods, it is important to understand the mechanism for communication and resource requests at the local and operational area level. Back to pod operations. Keep in mind that the structure of a pod operation must be flexible. In some situations, not all pod positions will need to be filled for the pod to function. Only positions that are required for an adequate response need to be filled. Pod staffing should be kept as small as possible to accomplish incident objectives and monitor progress. Let's review the key functions in the pod. Operations are the center stage of the pod mission, which is performing the medication dispensing or vaccination functions. The Planning and Intel branch reports progress to the pod site manager and, if designated, to the city EOC officials. The Planning branch keeps the leaders informed about how the pods are doing and plan for future staffing and supply needs. The Logistics branch manages the necessary supplies and equipment, from medicines to clipboards to copy machines. They'll make sure your station or area is supplied with everything you need. The Finance Administrative branch tracks and records everything. They will be responsible for purchasing supplies, maintaining lists of personnel, and other resources needed to support pod functions. Most of you will be assigned to jobs in the Operations branch. The dispensing or vaccination operation consists of 5 primary patient service stations and areas: greeter, fill out form, show form, pick up medicine, and turn in form. There are also 2 ancillary service stations: medical evaluation and special needs. Let's first discuss the flow for 85 to 95% of the clients entering the pod. Clients first enter the greeter area for general screening and triage. Most clients are not going to be sick or have special requests. They will proceed to the next station, which is fill out form. At the fill out form station, clients will be given an antibiotic screening form to complete. Clients may pick up medicine for other family members, but they will need to complete an antibiotic screening form for each person, or complete the multi-person antibiotic screening form. Next is the show form station. A forms reviewer will quickly check the screening form for all no answers. For those clients who answer no to all the questions, they will continue to the pick up medicine station. At the pick up medicine station, clients will be given their medicine or vaccination. This is meant to be a simple process. Clients will be greeted, asked to complete forms, forms will be reviewed, and medicine will be dispensed. Then clients will turn in their forms and exit. I have just described the flow for the majority of the clients at the pod. This is called the express model. Now let's describe the flow that takes people out of the express model. Starting at the greeter area, clients will receive a general screening and triage. If sick, the person will be referred to medical evaluation. Clients who require special assistance due to mobility, communication, or sensory impairment will be escorted from the greeter area to the special needs area. Special needs is a one-stop shopping station. Although limited, staff will be available to serve as interpreters and to medically evaluate clients at the special needs station. Another area where clients may be pulled out of the express line is the show form station. The antibiotic screening form will be reviewed at the show form station. A forms reviewer will quickly check the screening form. If there are any yes answers, these clients will be directed to medical evaluation. At medical evaluation, a healthcare provider will finalize the antibiotic selection for the client, who will proceed to the pick-up medicine station to receive their antibiotic. Similar to the express model, clients will drop off their forms at the turn-in form station and then exit. If clients have questions, they can ask them at the question and answer area. This is the process that we have tested and believe will work for our local communities. A public health disaster will be a very stressful experience. Some people may need help coping. If you're caring for a patient and they're having trouble, you can call for assistance from mental health workers moving about the pod. Once again, the number one priority at a pod is to provide PEP and good public health care as efficiently as possible. Do your best to communicate quickly and keep the lines moving. While you're busy taking care of everyone else, don't forget to take care of yourself. Remember to take food and water breaks as needed, and bring any medical supplies you may need, including basics such as aspirin. One more thing. While the plan described here addresses an anthrax response, the pod infrastructure may also be applied to many other types of public health disasters. To learn more about pods and public health disaster response, Alameda County Public Health Department has created a video game designed to enhance your understanding of various pod roles. Alameda County Public Health Department thanks you for watching this presentation. Advanced training and preparation for public health disasters help ensure that we're as ready as we can be when our citizens and visitors need us.